to support people in a seamless way who need the supports and services that you provide with all of your burn partners. And money is beginning to move out the door to fund the very services that you all applied for. So despite all the ups and downs all around, we are at an amazing point. And if you recall in the orientation meetings that we gave, we said that once you all got funded, we would still be there to help support you in this process as we move forward. And that's what we want to talk with you about today, is what the next steps look like after the process of being successfully funded is. And we'll have burns, in some cases more than one, in every Oregon County region. We are now at 29 approved, so only 7 to go. We expect maybe a couple more next week, and we're hoping to have all county regions approved within a month or so, and certainly by the end of August. I'm hoping not to jinx myself. So a couple of housekeeping things. If the name on your screen is not your own, there have been instructions. It was just the way that this was designed, so that you can put in your true name. There's 3 dots. If you hover over your screen, if you click on those 3 dots, you'll should see a menu come down. At the very bottom is an option called Rename. Click on that, and a screen should pop up in the middle where you can put in your name. What we would really like you to do, if you would please, is to put in your first, last name, the organization you work for, and the pronouns that you prefer. All right, so with that, just a couple of other comments, and I'm going to turn it over to Angela and Kristen, who will walk you through a PowerPoint that we have today. We promise it won't be death by PowerPoint. We will open it up for questions and concerns that you may want to raise. We ask that you put your questions in the chat, please, and feel free to do that now. Feel free to do that at any point along the way. After our presentation, which should be half hour, 45 minutes tops, we will open it up. We will read your questions individually, and then as best we can, we will respond with answers. If we can't answer it today, we will answer back in writing to the group as a whole. So again, welcome. Really excited to be at this point with you. And with that, Angela, I'll turn it over to you.
Hello, welcome everyone. Thank you for joining us today. I am truly, deeply excited for this meeting and so grateful that all of you have joined us in this work. This is a transformational program. The goal of Measure 110 is to reduce the stigma around substance use and truly recognize it as the mental health concern that it is, and that it deserves support and assistance. And our goal is to assist as many people across the state as possible in receiving wraparound support services and care to help them mitigate their substance use and have a recovery that they would like to have, and find connection and community, and have the life that they would like to live, free of substance use concerns. So again, thank you so much for joining us in this work. We are so grateful to all of you for being a part of our networks. And I will go over our agenda and cover a few things here, but I just really want to emphasize that this is just our first touch point. We will be connecting with you many times. We'll have opportunities for you to meet with us, to ask questions, to get technical support. So if your questions are not answered in this meeting, please know that we are here to help, and we will be happy to guide you in whatever ways necessary to help you understand what needs to happen to fulfill program requirements, to support the people that you are supporting in the community. So just know we're here to help. So for today, we're going to do a brief overview of the Measure 110 program. We'll talk through the grant agreements and the milestones that are expected for programs to meet. We'll talk about some of the tracking of those milestones. We will be sharing this PowerPoint with you, so you'll have access to all of the information in it. So we do have included some information about statutes and regulations that will be guiding this work. And we'll talk through our recurring meetings that we will have coming up for you to connect with us, ask questions, get support. And then at that point, we'll take a break, and then we'll come back and go over any feedback or questions that you would like to have answered. If we are not able to provide an answer at this time, we will be including answers to your questions in a frequently asked questions document that will be sent out to all of you. All right, let's go to the next slide. All right. So I am sure that many, if not all of you, are very familiar with the Measure 110 program at this time, since you have meticulously crafted your grant applications and thought very deeply about how you would like to create programs that will better support your community. But overall, the purpose of Measure 110 is to provide access to health assessment, treatment, and recovery services for folks who have struggled with substance use, and to make sure that those services are using a health approach to substance use by removing criminal penalties and removing stigma. I really want to emphasize that piece. We are working hard to change the culture around substance use and understand that it is a mental health concern, and like any other mental health concern, should be treated with support and understanding. Before we go into the rest of the slides, I would love to have an opportunity to let you meet some of our Measure 110 team so that you can begin to put names to faces for the people that you'll be working with. So I will pass. I suppose I should introduce myself. For those of you who maybe have not seen me before, my name is Angela Carter. I use they, them pronouns, and I am the program manager for Measure 110. And I would pass next to Jessica Carroll, if you would be ready and willing to introduce yourself.
Good morning, everyone. My name is Jessica Carroll. I use she, her pronouns, and I am also a manager of the Measure 110 program.
And next, I know that many of you have already had the opportunity to meet Kristen Don Hefner. She's been working with many of you on negotiations on the grants. And Kristen, if you would like, please go ahead.
Good morning, everyone. It's nice to see a lot of familiar faces. I hope you're not too sick of me yet, because you will we'll definitely be continuing to work together. But I have been helping lead all of the negotiation work, and will continue on this journey with you all going forward.
Thank you, Kristen. And next we have Sydney McConnell.
Hello, my name is Sydney McConnell. I am program support for Measure 110, and I just wanted to remind everyone that I am, or we are, keeping track of your questions, and they will be answered at the question and answer section of the meeting, if not before. So just know that we are taking them. I don't want to clog the chat up with acknowledging them, so that they are being tracked.
Thank you, Sydney. And then next, we have a few of our grant administrators who will be working with you to help support you in understanding your grant agreements and programmatic requirements. So first, I would pass over to Jess Havey.
morning, everyone. My name is Jess Habe. I use she, her pronouns, and I'm one of your grant administrators. And welcome, everyone.
Thank you, Jess. Next, we have Tim Scott.
Hi, everyone. My name is Tim Scott. I'm also one of the grant administrators here with Measure 110.
Thank you, Tim. And Hayan Chung.
Good morning, everyone. My name is Hayan Chung. I use she, her pronouns, and I look forward to working with you guys. Thank you.
All right. And so just for information, we will be reaching out to you shortly to let you know who your specific grant administrator will be so that you have a connection touch point and can reach out as needed. But also, I really want to emphasize that we will have regular meetings on Tuesdays and Thursdays for you to come and connect with us, ask questions, and get support. So we'll be reaching out soon. All right, so let's go to the next slide. All right, so next we're going to talk a little bit about our next steps with meeting the milestones for your grant agreements. All right, so for ongoing support for all of your programs, we are going to, for the first 3 months or so, have bi-weekly support spaces. Like I said, those meetings will have to engage with you and help you understand what the program is looking for and our council's values and visions for the program, give you technical support, and just make sure that things are going smoothly. We will be sending out the initial fund disbursements once we have received all of the MOUs from you and your county. We will have a checklist available to help you understand what needs to occur in the first 90 days of your grant agreement. We will be communicating regularly about grant agreement submission requirements. We'll let you know when things are coming up to be due, and we'll remind you if we need to, if we are still looking for something from you. And definitely the team will be reaching out to offer support on all of those things. We will have a frequently asked questions document. In that document, many of your questions should be answered. If you see something missing from that list, if you're not able to find an answer to your questions, please do bring it to these initial support meetings, and we will answer you as best we are able there. If needed, we will consult with others to get the right answers for you, and then we will be sure to include that in the frequently asked questions document. So that document will be sent out to everyone, and it will also be available on an ongoing basis, being updated on the Measure 110 website. And then there will be a fiscal report for the first quarter that will be required. Oh, can we go back for 1 minute to the last slide? I'll go through the rest of the months real quick. So after the first 3 months, we will have more program monitoring beginning, and an initial performance report would be something that you would start to build. That would be submitted at and just after the 6-month mark. And we'll be keeping up with you throughout this time period to support you in understanding what you need to retain for your records, what you need to gather information-wise to share with us for your reporting. And we'll definitely let you know what needs to happen. And then after the 6-month mark, we will continue to follow up about quarterly reporting requirements. We'll have financial and data reporting requirements that we will definitely keep you informed of. And we will begin to let you know about our findings from those reports. All right, now we can move to the next slide. Thank you. All right, so those milestones that I mentioned earlier, we have a couple here in the next 90 days or so after grant agreement initiations. We do need to receive all of your memorandums of understanding for all of your partners within the burns that you are in. So anyone within your burn, if there are multiple burns in your county, you would need to have MOUs within your burn, but not necessarily with the entire county. So once we receive those memorandums of understanding, at that time, we would be able to do the funds disbursement. We also have a requirement for a set of policies. We'll talk more about that in a little bit. Kristen will review that information with you. I want to let you know that we will be sending a template for those policies to help you build out your policies and understand what the requirements are. If you already have policies in place that address all of the 12 areas of those policies, you do not need to create a new set of policies. You can simply send us the set that you already have. As long as it covers all of the areas that need to be covered, that should be completely fine. We're sharing the template for folks who have not previously been able to build policies for their organization to support them in that process. Then next we have progress reports. We have a phased data plan. We'll be slowly walking from a simplified data collection plan to more data collection as we go, with the goal of minimizing the effort required in the first few months, and then eventually working towards compliance with SOGI and REAL-D data collection. And then there will also be fiscal reporting requirements, basically having you let us know how you're spending your funds, how much you've spent in each quarter, and various other information. But we will definitely give you more details about those reporting requirements as we go. All right, next slide. All right. So if you would please familiarize yourself with your grant agreements. Very helpful to read through so that you really thoroughly understand what the program is requesting from you as far as reports and as far as programmatic work. Of note, there is a section that I'd like to call attention to. Exhibit B, number 10, discusses records maintenance and access. So I just wanted to let you know about some of the requirements of records maintenance when working with OHA, with grants. We do request that you maintain records for 6 years, and that those records be maintained and made available as needed or requested by the Oversight and Accountability Council and the Secretary of State office, so that they can be reviewed if needed. We have some requirements of insurance certification. There are a number of different insurance types that have been requested from all burn partners. That information is available in Exhibit C under insurance requirements. So there's a requirement for workers' comp and employer's liability, commercial general liability, professional liability for your service providers, possibly umbrella insurance to meet the required limits if the other forms of insurance do not do so, waiver of subrogation, a tail coverage if your insurance ends and you need to maintain coverage. We require at least 24 months of tail coverage. And so we are asking for all of your certificates and proof of insurance to be sent to us so that we have record of them and can maintain our knowledge that you are in good standing with insurance. If you change or cancel your insurance, let us know, and send us a new certificate so that we can keep record of that. And then again, those memorandums of understanding, we need those within 30 days of grant agreement so that we can send you your grant funds. All right, next slide, please. All right, so next we're going to talk a little bit about milestone tracking. You can go ahead. So there's a few things that I mentioned earlier, the fiscal reporting, the data collection, the certificate of insurance, and the policy and procedures submissions. All of those are coming up. We will help you to remember and understand what those requirements are. But this is just a slide to let you know sort of the cadence. We'll be doing the policies and procedures first. We'll receive those certificates of insurance from you. Then we would begin the fiscal reporting at 3 months, and the data collection would begin at the 6-month mark. Okay, next slide. All right, here's a little bit more information on the reporting requirements. The policies and procedures, the list of required policies and procedures can be found in the Measure 110 Chapter 944 rules in section 0020. There is a list, but we will also share information with you in the policy template about that. So those are, again, due within 90 days of receipt of the template. This is slightly different than what's in the grant agreement. We want to make sure that everybody has the opportunity to review those templates and build out their policies and procedures with enough time to do so. And then as far as programmatic reporting, we will be requesting client data from you in compliance over time with REAL-D and SOGI requirements, with the caveat, which is down below here on the slide, that this is a stepped process. We are beginning our data collection gently to give you the opportunity to focus on building your programs, and we will work towards having complete alignment with REAL-D and SOGI requirements. So the first set of collection is going to be number of clients served, number of clients denied, average wait times to access services, etc. And then we'll slowly build from there. And then as far as fiscal reporting, we would ask you to share with us the total cost data for each of the categories in your budget, and what services the budgetary items were used to provide. And we will be giving you a more detailed template to assist you with that reporting process in the future, very shortly. All right, next slide, please. And I believe, is this where, Kristen, you are taking on the next set of slides?
Sure, happy to.
Okay, thank you.
Thank you. We're all trying to save our voices from all of the talking we do every day. So here we've laid out the all of the categories of policies and procedures. Each BHRN partner individually, so not as a BHRN, but as an organization, must submit all of these required policies and procedures in order to be in compliance with the grant agreement and the underlying legislative statute. If you do not have policies and procedures for these categories, that is totally fine. And we will be providing guidelines and templates for you to use as a starting point. I believe Angela mentioned this, but I want to underscore that we will not require you to submit your policies and procedures for your organizations until we actually provide those templates to you. So the 90-day clock hasn't started yet, and it won't start until you receive those templates. If you already have your own policies and procedures that do align with these program areas, you can submit those to m110.grants@dhs there's a typo in the slide, dhsoha.state.or.us, I think.
There's some changes happening with all OHA email addresses. We're adding the O to the DHSOHA, so that is the email address that we'll be using. Just a heads up.
I do remember hearing that now, and that will definitely go smoothly. So apologies in advance when that shift happens and none of you can get a hold of us for a few days. Yeah, that is the right email address. But anyways, these policies and procedures outline kind of what we expect you all to be doing and what you're probably already doing. So look for those templates to come soon and submit your policies and procedures if you have them. Next slide. Okay, yeah, next slide. So I want to briefly just go over some of the statutes and regulations. We will make sure that you all receive these slides and you can bookmark these links if they're not bookmarked already. But as you know, there are kind of a network of federal, state, and local laws and regulations that will apply to your work between federal privacy standards, state Medicaid and Controlled Substance Acts, policies and procedures, and then any local specific county codes. We expect you to follow the law. And so this is just a reference guide for all of you to bookmark. And again, you'll get these slides so you have it as a reference. Next slide. We also break down some of the state level laws for mental health programs, for addiction services, and for some of the other aspects of behavioral health care, such as adult mental health services, behavioral health policies, child and family behavioral health, and licensing and certification. We also have a monthly recovery report, which is an email communication to all behavioral health stakeholders for y'all to stay up to date on news. If you're not already subscribed to that, I recommend it, and we have that link in here as well. So just another kind of bookmark this slide and these links when you get them. Next slide. All right, as I think that we outlined in a lot of your welcome meetings, and I know we've had a lot of questions, we are going to be asking you all to collect both RealD and SOGI data information from your clients eventually. That's the race, ethnicity, age, language, disability, and sexual orientation and gender identity questions. And the goal and the rationale for collecting all this information is really to make sure that the services that are being provided under Measure 110 and across the healthcare spectrum are centered in equity. And this data will allow us to make sure that we are reaching folks who have not only been harmed most by the war on drugs, but who need these services the most. So we are starting in a phased approach, recognizing that these are a lot of questions and they are not in alignment with MOTS, the Medicaid data system. And so we are going to be phasing these questions into the Measure 110 program in a kind of stepped approach and transition our basic data collection towards collecting this information in the future. But we just want to let you all know that we were not expecting it on day one, and we will continue to work with you to make sure that you all can collect this information from the people you serve and report it in a way that will allow us to use it to further our health equity goals. Next slide. All right, we're almost done with these slides. I did promise all of you in our welcome and negotiation meetings that we wouldn't just leave you all in the wind to do your business. I did promise that you'd probably get sick of me. So we are going to establish a reoccurring meeting schedule going forward. These are tentative start dates of next week. They might slip another week, but we are going to have office hours and technical assistance meetings kind of on a weekly cadence. The office hours will kind of be an open forum for all BHRN partners to pop in, ask questions. Based on those conversations, we will be updating a continual FAQ document on our website, and we'll have that separate invite sent out. But this is really just kind of an informal pop-in space where you can ask questions or get connected with someone in OHA, depending on kind of what your question is, whether it's Medicaid or housing, to be able to answer those questions. We'll also have technical assistance meetings, and those will be a little bit more formal. We'll have regular presentation we'll be providing regular presentations regarding the program requirements. And that will be, again, just information sharing for us and you all, but we'll have that on a regular cadence as well. We're going to have some more of these BHRN kickoff meetings. So as you're talking to your colleagues in other counties, you can assure them that they weren't forgotten. They will also get this information. It's a lot to have hundreds of providers in the room, so we're trying to break you all into little chunks. But we will have some more of these so that everyone gets this information. And we're hoping that we will continue to see you and engage from you and learn from you and enable you to learn from each other for these regular meetings. And I think we have one more slide, perhaps. Yes. So I know there's still a lot of outstanding questions that you have. I've seen them in the chat. I know we've talked about them. But about Medicaid, about real property, about lines for life, we will have additional details about all of these, about how to become onboarded into Medicaid if you're not a Medicaid provider, or how to maximize your billing. We have all of the technical support available. We'll also be sharing a little bit more information about real property purchases. I know we flagged that there would be some additional policies around real property purchases, and those are getting finalized. We also are continuing to support Lines for Life, and we'll have more information about their role in the future. And we are, I think I mentioned, going to be collecting and updating a FAQ document that will hopefully be able to address some of the questions that were asked today and in the future, so that it lives somewhere on the internets and can act as a just bookmarkable reference point for all of you. So I think finally, the last slide we have is we want to also hear from you. I think this is meant to be an iterative process. We don't know what we don't know. And we appreciate you being kind of willing to step into the void with all of us and take this big leap of faith into providing new services, expanded services, and to participate in a brand new project that has a national spotlight shining on it. So we want to know what topics you're interested in hearing about during future office hours or TA support meetings in the FAQ document. And we would just like feedback in general about how things are going, things that we can be doing better, ways we can communicate better with all of you. Thanks to Zoom, I feel like I've been on a really fun tour of the whole state. from Malheur County to Clatsop County and everywhere in between. But it does allow us to really connect and learn from each other, and we want to continue to facilitate that. So all of that to say, please stay in touch and drop your ideas in the chat. You can continue to pester me. I will not mind. And I think with that, we can open it up for questions and maybe start with responding to some of the questions that have come in to the chat and go from there.
So in order to make sure that everybody has time to think through their questions and get them into the chat, I think that we were going to take a 5-minute break here. So please add any questions that you have at this time to the chat. We will open it back up in about 5 minutes. Let's go for 10:50. We can open it up again and we will review your questions, do our best to answer them. If we're not able to answer them here, we will make sure that we get an answer for you and include answers in the frequently asked questions document. All right, so take a break, get some water, get some more coffee, stretch a little bit, and we'll come back at 10:50. Thank you. All right. Welcome back, y'all. It's 10:50. We're going to get started here again with some questions and answers. Looks like there's some introductions happening in the chat. Katie's are meeting each other. And we have, I think, a list of pretty good questions that we will do our best to answer at this time. All right. So Sydney has been collecting your questions in the chat and is going to be helping us go through them so that we can answer them appropriately. So whenever you are ready, Sydney, please go ahead.
Okay, I'm going to just read them in the order and go from there. And some of them were answered, so I'll just read the question and the answer as it was answered.
Perfect. Thank you.
So the first question was from New Directions Northwest. We're getting a lot of requests for housing assistance from SUD clients in our burn area. However, we are only to assist those with a Class E violation. Please, ? Please define population to be served.
That is a very good, very important question. Thank you. So the Class E violations are only one part of Measure 110. Those violations are not a restriction at all on who may be served. Anyone who needs assistance with substance use concerns is a part of your service group. They don't have to have a Class E violation. There's no requirement for really anything but the need for support with substance use. You can support people who do have a diagnosis of substance use disorder, but you can also support people who are struggling with substance use but have not yet received a diagnosis. So really anyone who needs support is part of your service population.
Okay, the next one, we actually got two, and this one was answered. It's how to get copies of the PowerPoint slides. And Kristen stated during her piece that the attendees would receive these slides. The next question was from Bridgeway Recovery. This burn provides funding through 2023. As we build new services, what funding will continue in 2024 and beyond? Will we need to reapply for funding?
Also a very good question, yes. So these grant agreements are an 18-month period. This is our first round, and subsequent rounds will occur. The Measure 110 program is funded through the DTRF, the Drug Treatment Recovery Fund, which receives quarterly disbursements from cannabis tax funds. And so those funds will be ongoing, received by the Measure 110 program. They will vary because taxes collected depend on cannabis sold, essentially, and that fluctuates. So we may receive more, we may receive less for any given year, but the funding is ongoing and we will continue to provide grants using those funds. The next round of grants, we are just beginning the work on that process, and our council will be going through that process shortly. So at this point, we don't have a complete description of what that process will look like, but we will in the near future, and we will share that information with you as soon as it's ready.
Okay, next question is from the Eastern Oregon Alcoholism Foundation. The burn has to be up and running in 30 days. Is that correct from the date of funding disbursement?
I am seeing that there may be some difficulty with hearing me in the chat. Is that the case still for everyone? If you can hear me okay, would you give me a thumbs up? Okay, I'll try and project a little louder so that I can come through a little clearer. So the burns implementation process obviously you would need to receive your funds prior to setting up your programs. You need to have funds in order to build your programs. And so the 30-day requirement is for us to receive your memorandums of understanding with the other members of your burn. Once we receive that, then we would disperse the funds. And we understand that this is a new program. This is a new system. You are doing a lot of work to lift up your programs and get them going. And so I do not believe that there is any requirement for a set date for your burn programs to begin. We want to help you as much as possible in getting those services ready and out to community. But the deadline is for the MOUs, not for services to begin.
The next question is from the Miracles Club. And I apologize, I didn't note where it came in, but the question says, does it have to be the whole county or just the burn you're part of? I actually believe that was when they were talking about the policies coming through. And then Kristen clarified that, that they're for the individual and organizations, not across the entire burn.
Right. So the policies are for each individual organization. Each organization would submit their policies to us by the 90-day mark after receiving the template to create those policies.
Okay. The next question came from the HIV Alliance. Will each burn have its own funding/grant period? I know different burns will be starting at different times.
I had a slight glitch in my audio. I'm sorry, Sydney. Would you mind repeating that?
Yeah, sure. The question.
Audio. Hello, can you hear me? Yes, that was me, that question I asked. Can you hear me?
Yes.
Oh, okay. So I want to clarify that question. I think it was I maybe didn't put enough information in there when I asked the question. The question is for the funding to start in any particular county. If you're a part of a burn and you get all your MOUs signed, do we have to wait for the whole county and all the other burns to sign their MOUs before our contracts are made and funding is released?
Thank you for that question. I appreciate it, Juliet. I know that most counties will have one burn. There are some counties that will have multiple burns. And I would pass that question to be sure with the counties that have multiple burns. Would anyone have a clear answer on when the funds would be dispersed? Is it when the entire county is finished with their MOUs, or is it when each individual burn has collected all of their MOUs?
It's each individual burn, Angela.
Thank you. Okay. So then each individual burn, once we have all your MOUs, we would be able to send out funding. Thank you for the clarification.
Yes, thank you, because I've heard so many different things.
So this is Amanda from HIV Alliance. So my question actually was, will each burn have its own funding period? So like we're involved in burns in a number of different counties, and each of those counties is on a different timeline right now. So I'm wondering if that will continue, if they will continue to be on different funding timelines, or if those will all be lined up at some point.
Okay, so I think I'm understanding that you are asking about, is it perhaps about reporting cadence, like when you would be requested to submit reports based on the timeline?
Right, because you all are talking about timelines of, at 90 days, having fiscal reporting, and then at 60, or I don't remember exactly what it was, but at, I think it was 6 months, the program reporting. And so I'm wondering if those increments are going to be different for different burns, or if those are going to be lined up across the whole state. Does that make sense?
So the plan with reporting is that we will have everyone on a similar cadence with reports. So for instance, with the fiscal reporting, we would be requesting that information along with a data report after the 6-month period, so around mid-January, for all the burns, regardless of start time. We would ask for a submission of the fiscal report from the 3rd quarter of 2022, as well as the data report. And we're setting it up so that folks have the time to make sure that all of their data is collected and organized. So we would not request the data from you until you've had a moment to get it organized. So, 3rd quarter 2022 reports would be due in January. Does that make sense? And it would be due for everyone on the same date.
Yeah, okay. Thank you.
Thank you for the question. All right, Sydney, would you be okay with continuing with the written questions? And if you have questions, we do really want to answer them so that we have a record of all of your questions. Would you please write them down in the chat so that we can make sure that we answer them correctly and also record them appropriately in our frequently asked questions document? Thank you.
Okay, so the next question came from Ideal Option. It says, we are required to have policies and procedures in place within 90 days. 2 questions. 1, does the 90 days start once all burn members have an executed contract or based on the first executed contract? If you want to answer that one first, and then I can do the second one.
So the policies and procedures, as we said earlier, will be offered to you in a template form so that you can create policies that align with the 12 requirements. And that template will be coming to you shortly. The start date would be when you receive that template. So once you receive the template, you would have the 90-day clock would start. And so that would be for everyone in the burn receiving it at the same time would have those 90 days to create those policies.
Okay, the second question is OHA developing templates for those policies, procedures? If yes, what is the timeline?
Yes, we are developing a template for those policies, and that template should be coming to you shortly within the next few weeks. We will let you know as soon as we can when they are ready and send them to you as soon as they are.
Okay, the next question is from Benton County. Just want to double check that these policies are for the 12 areas are handled at the organizational level and not shared formalized policies across the burn, which again, Kristen answered and stated they would be through the individual organizations, not across the burn. The next question was also answered. It was, I was informed by IT that RealD and MOTS are not complying with each other. Do you have any information? John Collins answered this in the chat that we will not be requiring entry of MOTS data for the burns for roughly 12 months. We will be using that time to make changes to MOTS and RealD. John, would you like to expand on that at all, or is that?
No, unless somebody has a question about it. Thank you.
The next question, we actually got 2 similar ones, and it was also answered. It was, who should we submit the certificate of insurance to? Angela replied in the chat with the email address, which again will be shared in these slides and with all attendees. The next question was also answered. Fiscal reporting 3 months from grant execution or 3 months from actual receipt of funding. Answered in the chat, the first report will be due January 15th and will cover July through September 2022 and quarterly afterward. If anyone wants to expand on that. Okay, the next question came from Washington County and was also answered. The concern was that not every burn provider was invited to the meeting. Can you assure that every burn provider will be included? To which Angela responded in the chat that there will be 2 more welcome meetings for partners to attend as they complete their grant agreements, and they will be included in a welcome meeting moving forward. And then there was a follow-up to that that was not answered that says, so only providers that signed their contracts were invited.
In answer to that, because this is a complex process and we don't want to overload folks with steps, we are working with the group of folks who are still completing their grant agreements to get those complete before we bring them to the welcome meeting, just to make sure that we don't overwhelm folks. It's a lot of information all at once, and we just want to make sure that each step is completed before we add in more information about requirements.
Okay, and I'm just trying to copy these new questions that have come in. So give me 1 second. The next question came from Lake County. Our plan includes hiring new staff. There is a nationwide behavioral health staffing shortage. We believe this will affect our implementation timeline. Can you speak to this issue?
It's a very legitimate point. There's a lot of things that are impacting behavioral health workforce right now, and we really do understand that. We are here to help you in any way that we can to find the staff that you need. If we can offer recommendations, let us know. But we do understand, and we do take into account that difficulty with workforce and finding staff.
Okay, the next question came from Bridgeway Recovery Services. How do we know you have received our MOU?
So again, that email to have all of your documents sent to is the m110.grants@odhsoha.oregon.gov. And it's actually on the bottom of the page here if you wanted to grab that just so that you have it for your records. But remember, we will be sending this PowerPoint to you, and we will give you other information that will contain that email address. And so the goal is for us to send out a notice of receipt email when we receive and record any of the documents that you've sent in. So we will respond to your email and let you know that we have received those documents.
And Angela, just to jump in there,
Yes,
for your
please.
MOUs, please continue to send those directly to me, not to that
Thank you,
email
Kristen.
address.
Thank you, Kristen.
I will come after you if we don't have them in a timely fashion. So I'm happy to look up the status of anyone's MOUs. If you have a question, you can reach out directly to me. If you're still working on your MOUs, please, when they're done, send them directly to me.
Thank you, Kristen. Appreciate it.
Thanks, Kristen. The next question comes from Iron Tribe. Will one certificate of insurance be okay, or will we need separate named one for each county we are a part of?
So that is a good question. And if the policies are different, let me get back to you on that one just to make sure that we have a clear answer to give you, because the policies may be different for different counties. We may have different needs around gathering those documents. If there's one policy that covers all service areas, it may be different. So let us get back to you on the specifics of that question.
Okay, next question comes from Youth Era. Concerned about the gap between hiring, we are ready to start on time, and when we will receive payment for FTEs. Odd wording. I'm gonna try to read it again.
Okay.
If you want, I can just just go, yeah, I was just checking. I think it's already answered though. My concern was that we had these, requirements around the time frame, and we're already trying to recruit because of the challenges with the workforce, and are already selecting candidates. So it's just concerned between the gap of trying to bring people on and get them trained up and then getting things started on time.
Okay, next question came from Community Counseling Solutions. Is there a listserv or a way for new staff attached to the BHRN program to receive invites to meetings or information from OHA?
Okay, so I think that this is a question about new folks joining organizations that have been hired through the BHRN grant process. We have a list of all of our contacts for each of our grant agreements, and those will be the primary communication. If there is someone in your organization that you would like to attend meetings instead of the person that we have listed, let us know, and we can make sure that the right people are invited to the right meetings.
Okay, next question. Please define the screening tool to be used by peers.
That is a good question. So in our Chapter 944 rules, in the first section of definitions, number 22 is the definition of screening. So this would be a process conducted by a peer support specialist, a certified recovery mentor, or a peer wellness specialist, or another professional in substance use to identify circumstances that require a comprehensive behavioral health needs assessment or any referrals to additional services and supports. And so we have a list, A through I, of what those screening needs should be, how you should meet those needs. So you would ask about acute care needs. Is there anything immediately that you need to maintain your health and well-being? That could be physical health and mental health. You would ask about treatment for substance use disorders and coexisting health problems so that there can be a complete understanding of what kind of support the client would need. Personal safety needs. So are they safe in their home? Are they experiencing domestic violence? And then appropriate referrals from there. What harm reduction needs they may have. So that would be finding out information about their current use, how they are currently using, and how they may need support to provide the safest use possible. Questions about addiction peer support. So what kind of peer support might they be looking for? You can explain and help them understand what peer support is and what peers can offer in that process. Questions about housing. So, are they housed? Are they housed safely? What kind of housing situation might they need? Do they need housing first? Are they not ready to stop using, but they still need to be indoors so that they can even contemplate their recovery process? Employment and training. Are they employed? Are they employed in a way that they want to be? Do they need assistance and support and training to improve their employment circumstances? If they have children, do they have childcare needs in order to go to and attend the services that they would like to have? Do they need assistance with taking care of their children during those times? And then last on the list would be food and basic needs. Do they have SNAP benefits? If not, then they could be referred for signing up for that. Do they have Oregon Health Plan? If not, then they could be signed up for that. Do they have clothing? Various other needs, just to make sure that they have their very basic needs met. So that's our list of required screening questions. Again, that is found in the Chapter 944 rules. in section 0010. Oh, no, I think it's all zeros. Let me see. Section 0010 in the definitions, and it's number 22 on the list of definitions under screening.
And the same person that answered the question just put a follow-up in the chat that says, please repeat the rule. And I know you just repeated it, so I just wanted to acknowledge that we saw it.
I'll put it in the chat as well, so it's written record.
And I will paste that when it comes in. Give me a second to get that.
There you go.
Perfect. Thank you. And I am pasting that. The next question is from Forest Grove. It says, as this becomes reality, it already seems necessary to revise budget line items and costs. Exhibit A, Part 2.1, Point B, Part 2 of the contract mentions that budgets, quote, may be revised and approved in writing from time to time by OAC, quote, end quote. Does this process exist yet?
It is a good question. It is a process that understandably will need to happen for some of the grants. And I think that we would want to take that on a case-by-case basis. We do, if amendments are done to grant agreements, we do have our counsel to review. And so I would say, let us have a conversation about that, your specific needs, and talk more about what might need to happen to make that happen if necessary.
Okay, next question is from an organization, and I apologize that it is not listed. We do not currently bill insurance as we are a peer-run organization with no full-time licensure and are working toward this. What would a patient insurance submission plan look like for us?
Also a very good question. So in the grant application and the grant agreements, there's a thorough discussion of the need not to supplant other sources of funding, but that is if those other sources of funding exist. We have funded a great number of peer organizations, and we do understand that not all peer organizations, not all harm reduction organizations, not all housing or supported employment organizations are set up to bill Medicaid. We do want to support you if you would like to become an organization that can bill Medicaid, and we will do what we can to assist you in that process. But if you are not able to bill, it is understandable, and we do not expect you to be able to bill if it is not a billable Medicaid service, or if you do not have staff that can provide billing for those services.
And
I
Angela,
see Shannon.
Yeah, I think Shannon will probably say what I was going to say.
Okay, please go ahead, Shannon.
Hi, folks, and sorry I'm not on camera. This is Shannon O'Fallon with Oregon Department of Justice, hoping to advise OHA and OAC on the matter. So even though the grant agreement might say that you have to submit this patient insurance policy, whatever the specific wording is, that provision is being waived by the council. So that is not something that you need to submit.
Thank you, Shannon. Thank you, Kristen.
Yes, next question comes from New Directions Northwest. We have been providing services and in particular housing assistance. What data should we be collecting at the time of quote service for these individuals?
So with the data piece, that is coming very soon. We are going to give you very thorough information on what you are expected to collect and to provide. I know that there are some requirements that have been set by other state regulations, and those would still be required for data collection. If you're already collecting that data, continue to do so. But we will definitely give you more information shortly on what needs to be collected and reported specifically for the Measure 110 program. And I see that John has come off camera. Is there any additional information that you'd like to share?
In addition to what you said, in the agreement, there is in the language around data and reporting, there's a reference to a web page on in our various on the web. Sorry, I'm not being very articulate. Let me start over. In the agreement, there's a web page that you go to that describes what the reporting needs are. As we've talked about, the reporting needs will evolve over time as we go from very simple to a little bit more detailed. We will be sending out notices to all of y'all as that website becomes updated, including these initial reporting requirements, which hopefully will be posted over the next week or so. So you'll have information in these forums that the Measure 110 team has set up. We will be sure to go over those details with y'all as well, so that you have an opportunity to ask questions.
Sorry, I'm noting these answers in case they're needed for the Q&A.
Thank you.
Sure.
Just a heads up, we have about 8 minutes left in this meeting. So if we do not get to your question today, please know that we will answer these questions and include them in the frequently asked questions. As we are able to add those going forward, we will continue to do so.
And just so you know, we have 3 questions left, so hopefully we'll get through all of them. The next one is, after this initial burn contract expires, does it get automatically renewed going forward in time? For example, is this the new legislation that will remain in effect in the future, that the marijuana tax revenue will be the funding source?
So at this time, yes, the cannabis tax funds are our source of funding. They will fluctuate and change. But as far as the next round of grants moving forward after the completion of these grants, we do not have a full description yet of what that will look like. And we will let you know as soon as we are able what that process will look like, what the grant applications process or renewal of grants process would look like. So we'll let you know soon about that for sure.
Next question is New Directions Northwest. This is a continuation of the previous question about data reporting. Due to high demand for housing assistance, what do you recommend for prioritizing requests, or do we fill requests till just till funds are all spent?
I think that's another question that we might want to go back and check on and put in the frequently asked questions document. It's a very good question, but I don't think that we can advise at this time how you would use your funding. So we will get our best answer for that and include it in the frequently asked questions.
Okay, and our last question that came in was, will organizations in multiple counties be required to attend additional welcome meetings?
So if you have services offered in multiple counties, the information in these welcome meetings will be essentially the same. The questions may be different. If you would like to attend, you would be most welcome, but it is not, if you've been to one welcome meeting, I do not believe that it is required that you would attend multiple.
So Angela, this is Larry Turner from Fresh Out Community-Based Reentry Program. I had my hand up for a minute. I don't know. I think I sent my question directly to one of the hosts because I didn't get an invite to this meeting, and I don't know if you got all my emails because I had asked Don earlier to put all my emails in there so that I could get this information about these meetings. And a couple other people that I know weren't aware of this meeting as well. So when I come to these meetings and I'm listening to everything that's being said, I don't see a lot of people who were in the war on drugs when I was in there. And it looks to me like we're not looking, it just looks to me, appears to me, it might not be what's going on, it just appears to me that we're looking through the same lens with the people who were the soldiers in the war on drugs that were administrating the war against my community. And most of the people in my community were prisoners of the war on drugs, because whites and other affluent people who were in the war on drugs were victims, even though they were participating in the war, and they got treatment, whereas we got punishment. Blacks, brown, and indigenous people got punishment. And I don't see a lot of those people being represented here on the panel by OHA. So I just don't know if this is going to really make a difference, or it's just going to be business as usual, because I don't see a lot of my people in here, and I don't see a lot of brown people in here, and I don't see a lot of indigenous people in here on this screen. And so how is this going to really impact and affect the people who are most impacted by the war on drugs if we're not hearing from them and have people in representation from their communities that are expressing what needs to happen about the war on drugs? I hear a lot of questions about, I'm hearing a lot of stuff that doesn't make sense to me. If people don't know how to spend this money already, we're not dealing with the right people, or we're not dealing with the right people. What we know so far is what we've been doing for the past 25 years that I worked in social services is not working. It's not working at all. So any approach right now would be better than the approach that we're doing. We're first in the nation in use and abuse, and last in providing services. So any out of innovative or thinking outside of the box, or trying to come up with some kind of new creative way to provide services that will help people, attract people that want to help them access services, I think is a great way to start. And we're not going to get that information if we're looking through the same lens and the same policies and the same procedures that we've looked through that's got us to this point. Like I told Steve Allen and Pat Allen, and like I told Governor Brown, we can always go back to what's not working. And what we're doing right now is not working. We can always go back to what's not working. So if we keep trying to change and make progress with the same system that we're using, we're just going to get the same results that we got. So I'm going to encourage everybody on here to try to get with your the people that you're serving, ask them what they think they need. Try it. If it fails, just keep on trying, because we can always go back to what's not working, because the system right now is not working. And the war on drugs is continuing with the people in my population. People are still being pulled over. People still being sentenced. People are still being denied housing. People are still being denied treatment services. People go to these white treatment programs that we have up. Their trauma comes up for them. They get kicked out of treatment because people don't know how to deal with them on a cultural basis. So we need to come up with more culturally specific services. We need to support more culturally specific service, and we need to support more people that got lived experience. We need to support more training for those people who got lived experience, so they can be ethically and professionally capable of providing the services that they know of, not the services that are available now, because this modality has failed tremendously in my community. And the social determinants of health have proven in the last 25 years since I've been in the social services of health that Blacks fare worse than any other population when it comes to health, housing, treatment, education, criminal justice, income, employment. Oregon has failed Blacks. And it goes back to the Constitution of Oregon in 1859, when the state was ratified as a state, where Blacks were not allowed to reside in this state, but white settlers were encouraged to get 600 acres of land. So we need a new lens to look through. And I'm willing to work with anybody who wants to look through a new lens. But if we're just going to do business as usual, Measure 110 is bound to fail.
Thank you, Larry, for your words. I just want to acknowledge and honor what you had to say. And in answer to your first question, so Multnomah County grant agreements are not yet complete and signed. And so counties that had not yet completed their grant agreements will be included in future welcome meetings. We staged it so that folks who are already finished with the grant agreements can then move forward with the next steps. But we didn't want to overwhelm folks with too much information at once. So we're doing it in pieces. So there will be a welcome meeting for Multnomah County coming up shortly. And everyone from Multnomah County, pardon the background noise, everyone from Multnomah County who was granted will be invited and a part of that meeting. you would be more than welcome to attend that meeting as well. But I absolutely hear you. I very much honor your words. Measure 110's intent is to increase capacity for culturally and linguistically specific services across the state. And that is definitely what we hope to do in any way that we can.
Angela, I'm not trying to target you, so I hope you don't think that. I'm just trying to put this out there. So as far as being overwhelmed, I was on the phone from Friday night to Sunday night. 7 people got shot and killed in my community. 7 people got shot and killed in my community. I had 3 people die of fentanyl overdoses at that time. So I can't possibly be overwhelmed with trying to get some services that's going to help them maybe prevent a couple deaths and prevent a couple overdoses. I need to be overwhelmed so I can try to get some services out here to the people, because people in my community is dying. So when we continue to put these linear models up and these time impacted approaches up, my community continues to suffer. That's what I'm talking about, looking at stuff through a cultural lens. If somebody's got this shit together, give them the money so they can go out there and help people. They shouldn't have to wait till everybody else gets started. That's why folks is dying. So we need to figure out a way how to look at this stuff differently than the same old way, because I just don't know. I'm overwhelmed. I'm overwhelmed right now, you know, because I got to go out here and talk to people's family members about how I can support them through the trauma that they're going through or their loved ones being died. Then I'm on both sides of the fence, because I'm supporting the victim and I'm supporting the shooter's family, because I know everybody in the community. So overwhelmed is something that I live with all the time. So being overwhelmed about getting some services that's going to help them is something that I'd much rather have the luxury of doing than being overwhelmed with trying to support these people through these murders and shootings in the community and fentanyl deaths.
I am so tremendously sorry to hear about the loss that you have had and your community has had in just the last few days. That is incredibly painful. I am so sorry to hear that. And I do hear you, and I do understand. Thank you for sharing. And I also want to acknowledge that it is 11:32, and we did say that this meeting would wrap up at 11:30. I know that this is sort of a rough note to end on, but please know that we do hear you and that we all really want to help community as much as we can, and we will do our best. All right. Thank you all so much for joining us today. If you would like to get this information again in a future welcome meeting, this meeting was recorded, so we will have record to share with you. If you'd like to rewatch, hear any of the information again, we'll be providing the PowerPoint for your reference so that you can use some of the links that we've included in that PowerPoint to get more information. And I see a lot of thank yous in the chat for the words that were shared by Larry. Thank you again. And at this point, we will take all of your questions. We will add them to the frequently asked questions document and share that out with community so that you all can be aware and understand what other people are thinking about and asking. And just thank you again. Thank you for engaging in this work. Thank you for supporting your communities. Thank you for bringing your passion and your heart to doing this work. It is so deeply important. You know, a frequent saying in my community is no more dead friends. And that is really our goal, is to just reduce overdose deaths, reduce deaths in general, support people in having the life that they are looking for through a recovery process, whatever that may look like to them, centering patients and clients in their decisions for how they would like to recover, and supporting communities that have been historically marginalized by and injured by the war on drugs. Thank you all for coming, and we will close now, and we will have welcome meetings for other parts of the state as they get their grant agreements finished. And we will begin with those technical support meetings shortly. And we look forward to working with all of you a great deal. Thank you.